Are rising healthcare costs threatening your retirement savings? With medical expenses climbing higher each year, retirees in 2025 face a tough challenge: how to protect their hard-earned money from being drained by doctor visits, prescriptions, and hospital bills. But here's the good news: it doesn't have to be overwhelming. In this video, we'll break down simple, effective strategies to keep healthcare costs from eating into your retirement. From choosing the right Medicare plan to using health savings accounts and reducing out-of-pocket expenses, you'll learn exactly what steps you can take to stay ahead of rising costs. If you've ever wondered how to manage medical expenses without breaking the bank, keep watching. By the end of this video, you'll feel confident in your ability to tackle healthcare expenses and secure a financially stable retirement. Understanding the major cost drivers in healthcare. Healthcare costs in 2025 are expected to rise significantly for retirees, and several factors are contributing to this increase. Medical inflation, which drives up the cost of services like doctor visits and surgeries, is a major contributor. As the prices for medical supplies, equipment, and labor go up, so do the premiums retirees must pay for insurance. An aging population also plays a big role. As more people reach retirement age, the demand for healthcare services rises, leading to overcrowded healthcare systems and more pressure on pricing. Older adults generally need more frequent care, which adds to the strain on the system and drives up costs. Another key factor is advances in medical technology. While these innovations often lead to better treatments and improved quality of life, they also come with higher price tags. New diagnostic tools, cutting-edge procedures, and specialized medications tend to cost more than older treatments, and those costs are often passed on to patients. This is especially noticeable when it comes to prescription drugs, where new medications can come with extremely high prices, forcing retirees to pay more out-of-pocket or through higher insurance premiums. Understanding these cost drivers is crucial for retirees who want to protect their savings and avoid unexpected financial strain. By knowing what's pushing healthcare expenses higher, retirees can make more informed choices about their insurance plans and better prepare for potential out-of-pocket expenses. This knowledge is key when considering options like Medicare, supplemental insurance, and budgeting for long-term medical needs. Medicare Basics: what every retiree should know in 2025. Medicare in 2025 continues to be a crucial resource for retirees, but understanding its parts and selecting the right plan can significantly impact your healthcare costs. Medicare is divided into 4 parts, each covering different services and with varying costs. Medicare Part A primarily covers hospital stays, skilled nursing facilities, and some home healthcare services. Most people don't pay a premium for Part A if they or their spouse have paid Medicare taxes for at least 10 years. However, there are still deductibles and co-insurance to manage. Part B covers outpatient care, doctor visits, preventive services, and certain medical equipment. In 2025, premiums for Part B will depend on your income, meaning higher earners will pay more. It also has deductibles and co-insurance, so it's important to plan for those out-of-pocket costs. Medicare Part C, or Medicare Advantage, combines Part A and Part B, and often includes Part D, which covers prescription drugs. Medicare Advantage plans are offered by private insurers and may offer additional benefits, like dental or vision care, but premiums and coverage vary widely depending on the plan. While these plans often have lower premiums, they may come with higher out-of-pocket costs, depending on the services you need. Part D focuses on prescription drug coverage. Premiums for Part D vary based on the plan and your income, and there are also deductibles and co-payments for medications. It's essential to choose a plan that aligns with your medication needs to avoid paying more than necessary. Medigap, or Medicare Supplement Insurance, helps cover the gaps in original Medicare, such as deductibles, co-payments, and coinsurance. It's important to choose a Medigap plan that fits your healthcare needs and budget, especially if you expect frequent doctor visits or hospital stays. Regularly reviewing your Medicare options ensures you're not overpaying or missing out on benefits. This becomes even more important as healthcare needs change over time. Beyond Medicare, retirees should also consider Medicaid and long-term care options to cover additional expenses that Medicare doesn't. These options provide essential support for those who may need extended care or have limited financial resources. Exploring Medicaid and long-term care insurance. Medicaid and long-term care insurance serve different purposes but can both help cover long-term care expenses that Medicare doesn't. Medicaid is a state and federal program that provides healthcare assistance for people with low income and limited resources. It can cover long-term care services like nursing homes or in-home care, but qualifying for Medicaid often means spending down your assets to meet the strict financial eligibility requirements. For retirees with limited income or significant care needs, Medicaid can be a lifeline, but it may not always cover all the services or facilities you'd prefer. On the other hand, long-term care insurance is designed to help pay for services like nursing homes, assisted living, or in-home care before you reach the point of needing Medicaid. It can provide more flexibility in choosing where and how you receive care, and it helps protect your savings from being drained by long-term care expenses. However, premiums for long-term care insurance vary based on your age, health, and the coverage options you choose, so it's important to weigh the costs against the potential benefits. It's typically more affordable when purchased earlier in life, ideally in your 50s or 60s, before any health issues arise. Deciding whether long-term care insurance is right for you depends on your financial situation, family support, and anticipated healthcare needs. If you have substantial savings or want more control over your care options, long-term care insurance may be a worthwhile investment. As retirees explore these options, it's also important to consider how health savings accounts, HSAs, and Medicare planning can support long-term healthcare management. HSAs offer a tax-advantaged way to save for future medical expenses, while careful Medicare planning helps ensure you're covered for unexpected costs. Maximizing health savings accounts, HSAs, and Medicare planning. Health savings accounts, HSAs, offer retirees a powerful tool to manage medical expenses while enjoying tax advantages. If you've been contributing to an HSA during your working years, those funds can now be used to cover qualified medical expenses in retirement, including Medicare premiums, out-of-pocket costs, and even some long-term care expenses. The key benefit of an HSA is that it offers a triple tax advantage. Contributions are tax-deductible, the funds grow tax-free, and withdrawals for qualified medical expenses are also tax-free. This makes it a smart way to set aside money for healthcare in retirement. Once you turn 65, you can use your HSA funds to pay for Medicare Part B, Part D, and Medicare Advantage premiums, as well as other qualified healthcare costs like deductibles, co-payments, and prescriptions. However, you can no longer contribute to an HSA once you enroll in Medicare, so it's important to maximize contributions before that point. For those still working past 65 and delaying Medicare enrollment, you can continue to contribute to your HSA as long as you're covered by a high-deductible health plan, HDHP. It's also essential to follow the rules for withdrawals to avoid penalties. After age 65, you can withdraw HSA funds for any reason without penalty. But if the funds are used for non-medical expenses, they'll be subject to regular income tax. This makes careful planning around withdrawals important to ensure you're using the funds in the most tax-efficient way. When it comes to Medicare planning, timing is everything. Enrolling in Medicare at the right time helps avoid late enrollment penalties, which can add to your healthcare costs. Most retirees should enroll in Medicare Part A when they turn 65, as it's usually premium-free. However, the decision about when to enroll in Part B depends on your individual situation. If you're still working and covered by employer insurance, you may be able to delay Part B without penalty. Otherwise, missing your initial enrollment window can result in a lifetime late penalty, so it's critical to plan carefully. By maximizing your HSA contributions and strategically planning your Medicare enrollment, you can minimize your healthcare costs in retirement and protect your savings. Managing out-of-pocket expenses. Tips for budgeting. Minimizing out-of-pocket healthcare expenses in retirement requires thoughtful planning and smart strategies. One of the simplest ways to reduce costs is by choosing in-network providers for your healthcare services. Insurance companies often have agreements with certain doctors and hospitals, allowing you to pay lower rates when you stay within their network. It's also important to take full advantage of preventive care services, which are often covered by Medicare or insurance plans without additional out-of-pocket costs. Regular checkups, screenings, and vaccinations can help catch potential health issues early, avoiding more expensive treatments down the line. Setting up a healthcare budget is another key step. Start by estimating your expected medical costs, like premiums, deductibles, and routine care. Then, build in a buffer for unexpected expenses such as emergency room visits or specialist appointments. This helps prevent surprises and allows you to manage your cash flow more effectively. To save money, retirees can also look into negotiating medical bills. If you receive a large bill, call the provider and ask for an itemized statement. You might find errors, or you could ask if there are any discounts available, especially if you're paying out of pocket. Telemedicine is another cost-saving option. Virtual visits with your doctor often cost less than in-person appointments and can be just as effective for managing chronic conditions or getting quick consultations. While these tips can help reduce general medical expenses, prescription drug costs are another significant burden for retirees. Rising prices for medications can quickly eat into your budget, making it important to understand your options for managing these costs. In the next section, we'll discuss strategies to help lower the financial impact of rising prescription drug prices. Prescription drug costs. Finding savings on medications. Prescription drug costs are a growing concern for retirees in 2025. Many medications, especially new or specialized ones, come with high price tags that can strain your budget. Fortunately, Medicare Part D and supplemental plans can help cover a portion of these costs. Medicare Part D provides coverage for prescription drugs, but the exact costs vary depending on the plan you choose, your medications, and the pharmacy you use. That's why it's essential to review your plan annually to ensure it still fits your needs and avoids unnecessary expenses. One practical way to save on medications is by switching to generic versions when available. Generics have the same active ingredients as brand-name drugs, but typically cost much less. It's worth asking your doctor if a generic alternative is an option for any of your prescriptions. Additionally, discount programs like GoodRx or the ones offered by certain pharmacies can further reduce your costs, often providing significant savings on medications not fully covered by insurance. Mail-order pharmacies are another excellent way to save. These services typically offer a lower price for medications and the convenience of home delivery, which is especially useful for those taking long-term prescriptions. Some Medicare Part D plans even include special pricing for mail-order medications, making it a cost-effective option. To avoid overpaying, it's important to regularly review your prescription drug plan. Plans and prices can change each year, so staying informed helps ensure you're getting the best deal for your medications. Managing both medical and prescription drug costs is key to preparing for unexpected medical expenses. Understanding and preparing for unexpected medical costs. Retirees should always be prepared for unexpected medical expenses, as healthcare needs can change rapidly with age. A sudden illness, surgery, or long-term care requirement can quickly eat into retirement savings, making it crucial to have a plan in place to handle these costs. One effective way to build a financial buffer is by creating a healthcare emergency fund. Setting aside a portion of your savings specifically for medical emergencies can provide peace of mind, knowing that you'll have funds readily available when the unexpected happens. A good rule of thumb is to calculate your average annual out-of-pocket healthcare expenses, then aim to save at least 6 months' worth of these costs in your emergency fund. This can help cover any large medical bills or sudden increases in expenses, like unexpected treatments or medications. Another option is to consider purchasing supplemental insurance to cover gaps in your existing coverage. Plans like Medigap or Medicare Advantage can help with out-of-pocket costs, such as deductibles, co-payments, and coinsurance. While these plans come with additional premiums, they can significantly reduce the financial burden if an unexpected medical situation arises. Practical steps, like regularly reviewing your insurance coverage, budgeting for healthcare expenses, and exploring long-term care insurance, can also go a long way in protecting your retirement savings. Even small contributions to a dedicated healthcare fund can make a difference over time. By preparing for unexpected medical costs, you can better safeguard your savings and reduce the risk of financial strain. Protecting your retirement. Savings from healthcare costs. To protect retirement savings from the impact of rising healthcare costs, retirees need to be proactive and strategic. One way to safeguard your finances is by diversifying income streams. Relying solely on Social Security may not be enough to cover both living and healthcare expenses, so having additional sources like pensions, investments, or part-time work can provide a buffer when costs rise unexpectedly. Maintaining a cash reserve specifically for healthcare is another essential strategy. A healthcare fund allows retirees to address out-of-pocket expenses without dipping into long-term savings or investments, helping to keep your retirement nest egg intact. Contributing consistently to this reserve, even in small amounts, can build significant protection over time. Annuities are also worth considering for those looking to create a stable income stream that can cover ongoing healthcare costs. By converting a portion of your savings into an annuity, you can ensure guaranteed payments for life, providing consistent income to manage medical expenses as they arise. Regularly reviewing and adjusting your retirement plan is critical as well. Medical inflation and rising healthcare expenses can quickly change your financial outlook, so it's important to revisit your plan each year and make adjustments where needed. Proactive planning is key to managing healthcare costs in retirement, and with careful preparation, you can protect your savings. In the final thoughts, we'll discuss why taking control of your healthcare planning in 2025 and beyond is more important than ever. The importance of proactive planning for 2025 and beyond. Managing healthcare costs in retirement doesn't have to feel overwhelming. The key is being proactive and staying informed. By understanding the factors driving up healthcare costs, carefully reviewing your Medicare and supplemental insurance options, and budgeting for both expected and unexpected medical expenses, you can protect your retirement savings and stay financially secure. Regularly reviewing your retirement plan, taking advantage of tools like health savings accounts, HSAs, and considering options like long-term care insurance or annuities will help you stay prepared. Small steps, like choosing in-network providers or using generics, can make a big difference over time. The most important takeaway is that you have the power to take control of your healthcare costs. Planning ahead now gives you peace of mind and helps ensure you're ready for whatever medical expenses come your way. Stay proactive, review your options regularly, and make smart choices about your healthcare. Doing so will put you on the path to a financially secure and worry-free retirement. Thank you for watching, and here's to planning for a healthy and secure future.